to the computer. Hey everyone, this is Representative Daniel Hernandez. During the Corona crisis, it's becoming a little bit more difficult to be able to communicate with folks. So I've started doing interviews with people throughout the community to make sure that you all have information and tools to be able to take care of yourselves and your families. Today, I'm really excited to have quite a few people on the line, but I wanted to share one quick update before we do that. Nogales and Santa Cruz County, being both a border community and being a rural health community, are areas that have different challenges. So today I wanted to make sure that we talk to folks that work directly in the healthcare system in Santa Cruz County, taking care of the needs of those that live there. And we had an exciting update yesterday. We were able to work with the governor's office and secure an advance payment of Medicaid, so the state access system, to secure an additional $1 million for Holy Cross hospitals this month. So they're going to get an additional $1 million to deal with the ongoing crisis in the state of Arizona, and particularly in Nogales and in Santa Cruz County. So that was one good bit of news, but I'm pleased to welcome Brenda Coppola, who is the Maternal Child Healthcare Director of Nursing, Gabi Calvillo, the Adult Medicine Director of Nursing, Dr. Philip Williams, the Pediatric Head of Department, and Dr. Eladio Pereira, the Medical Director. So I'll hand it off to Dr. Pereira to kind of tell us who you all are and kind of what you do, and then we can have everybody tell us a little bit more about their work in each of their departments.
Very good. Thank you very much, Representative Hernandez. We're very grateful for the opportunity to speak to you today. And really everyone in the state. This is everyone's illness. So we're glad to share what we're doing, but also learn from all of you as well. I'm the Chief Medical Officer at Mariposa. We are a federal qualified health center in Nogales. With me are the Directors of Nursing and Dr. Williams, who's been leading some of the efforts in terms of creating new workflows and managing our protective equipment. When we began working on the pandemic, we began putting together a team to help keep our communities safe. We knew that we could not do this by ourselves, so we knew that the team effort was the key to fight this. And so since early March, we put together, essentially we recreated new workflows for the clinic. And I think you early on in our offline conversation, we mentioned a few, and we can expand on that as we go, but essentially our main goal is to keep our community safe. This is a small county, about 48,000 people, and Mariposa plays a critical role, and all the systems we have created are meant to separate the healthy patients from the sick, creating some distances for telemedicine, and continue to work as much as we can to keep our community. Finally, we emphasize prevention, and we can touch on that. We've been doing some education to our community and others, but the prevention is key, and so we're happy to expand on that.
Dr. Pereira, before I let you go, can you tell us a little bit about how many locations the Mariposa Healthcare Centers actually have? Because I think one of the big things that people don't know is how many different people you all work with on a daily basis previous to the pandemic, but now more importantly than ever, the amount of people that you have to cover and the amount of locations that you have. So if you could just give us an idea of how many locations you all have to serve the community in Santa Cruz.
Our main location is in Nogales. We have several buildings where we see adult patients, pediatrics, and OBGYN. We also have another location in Rio Rico, Arizona, which is about 15 miles north. The third location is in Tubac, Arizona, which is about 25 miles north. And a fourth location in the town of Patagonia, which is about 20 miles northeast of this site. We see somewhere between 24,000 patients, and we have about 25 healthcare providers, both physicians and nurse practitioners. So you're absolutely right. In terms of managing our patients, it's clearly a challenge given the how fast we needed to make changes. But I think we're trying to do essentially all at once. But I think our community has responded really well. They know what this is about, and we're happy to be given this opportunity to do what we have to do to keep each other safe.
Perfect. Thank you, Dr. Pereira. So, Gabby, would you like to go next?
Yeah. Sure.
So Gabby can talk a little bit about briefly, and Brenda as well, about specifics, about essentially we have created new systems. We're doing all the screenings, and Gabby can talk a little bit about the screening. How do we do that? Keep people outside. And then Brenda can do the same. And then Dr. Williams can talk about maybe a little bit of the testing that we're doing, given the short supply of tests that we have, but we're doing some. And then more importantly, I think Representative Hernandez, you want to know, I know the state is concerned and the governor's office is concerned about protective equipment,
yes,
how we're conserving that, and what kind of strategies we're doing to use them properly. I know that's a concern for the governors and Dr. Christ, and I'm sure you as well. So that's something we can talk about. So Gabby, you want to talk about the screening, and Brenda can follow.
So we have screening tool that we have developed when patients are coming into that need to be seen by the providers. We ask every patient that's coming in if they're having any symptoms such as cough, shortness of breath, fever, if they have changes in smell and taste. We also ask if they've been in contact with anyone who has tested positive to COVID-19, and also if they've been recently traveling to domestically or internationally as well. If in case we do get a yes to those, the patients are then seen in a secondary screening station where the patient is evaluated further by a licensed nurse, registered nurse. And at that point, the patients, if we feel it is something, it doesn't necessarily have to be COVID concern, or it could be some sort of infectious disease that we're concerned about, where we'd rather have the patients be seen outside. We do have tents available that are fully supplied. Providers come out in their PPE gear, and they see the patients out in the tents. They're able to prescribe medications if needed, and that is done whichever pharmacy they use. We also have a pharmacy ourselves, which we've also made some changes to, and which has been working out really great, actually. That way, the sick patients are kept outside, they're seen outside, and the healthy patients are able to come inside and get seen also. So that's the current process that we have right now.
Gabby, one of the questions that I've been getting from constituents is, why are my doctors telling me not to come to the clinic? And can you talk a little bit about why we are encouraging people to either do telemedicine or to potentially be seen outside in one of the tents instead of actually coming into the facility?
I'll have Dr. Pereira answer that.
Okay, thank you.
Actually, I'll say briefly, and I'd like to have Dr. Williams as well. So we know that this is a respiratory illness. Coronavirus is. It is transmitted by respiratory droplets. The virus travels probably less than 6 feet. At least that's what we know. And so as such, given the pandemic, I think it's safe to assume that patients who have respiratory symptoms should be distanced from each other, distanced from the healthcare providers. And so that's essentially the reason we want to identify those patients so we can keep the distance, still manage them, evaluate them, and treat them. But we know that creating that safe distance is really going to be important for us to manage this. I think telemedicine is a good option as well. We're not able to manage 100% of the situation via telemedicine, but we can manage a large portion via telemedicine. If we still need to see them, we will see them. We'll give them an appointment and we'll be able to evaluate them appropriately. And I'm sure Dr. Williams will have something to add to what I just said. Dr. Williams, you would like to say something?
No, thank you. Distancing is important for a couple of reasons. One of the main reasons is, and if you watch the news, you'll hear Dr. Fauci. He's on the president's response team. He's one of the leaders in infectious disease and one of the leaders in coronavirus response in the country. But Dr. Fauci says that basically distancing is important for a couple of reasons. Well, one, you have to kind of look at the natural course of the disease. Back January 1st, in early January, there was, one case. And now I don't even know what the numbers are. Like last time I checked, there was over 60,000 cases in just three or 4 months. So when you look at the graph, it's an exponential curve. So anytime you have exponential curve, it means that, of course, you have a high number of people that are infected very, very quickly. And one of the reasons for that is just by how contagious the virus is. So a couple ways to combat that. The main way that we hope is that, in the next few months or a year, we'll have a vaccine. That's the main way. Vaccines are, the biggest advance in medicine in the last 100 years. And once we develop a vaccine, and also more importantly, once people have immunity in which we can test and show that patients have immunity, that's the main way that we're going to actually combat the virus. But until then, a way to provide a speed bump in the spread of the virus is through social distancing. So basically, if you stay at home, if you don't interact with other people, then obviously you can't spread it. And it's worked in other areas. If you looked at places in Europe and even in places here in the U.S., like New York, that have had really rapid spread, those numbers are, we hope, slowly starting to come down just because of all the social distancing measures.
And that's a concept that I know myself and Senator Sinema and a lot of other elected officials have been calling for, the idea of flattening the curve, because like you said, it's an exponential growth rate unless we take action to really flatten that curve so that people aren't getting as sick or spreading it as much. So thank you, Dr. Williams. I think that's a really important point to kind of hit on, because people are getting frustrated and they're getting really antsy as they're being forced to stay home. And a lot of them are saying, well, I'm not sick, my mom's not sick, so I'm gonna go outside just to the grocery store or just to do this. But if we have enough of the folks leaving their homes just to do their one thing, and they're in large spaces with a lot of other folks, they're exposing themselves potentially, but also exposing others because may be asymptomatic and not know that you're sick and potentially be spreading COVID-19. So thank you, Dr. Williams.
That's exactly right. I think the concern that we have is that we all need to be part of this, and that we could be asymptomatic and spread it to others. I think for testing, we emphasize symptomatic individuals, but it's worth remembering this is a respiratory disorder and it's easily transmissible. And there have been reported cases where someone has been essentially confined to their home. They go out to the grocery store and they become infected. So we need to protect each other. Absolutely.
Thank you. I know that we were talking about kind of how you all are dealing with the ongoing crisis and the pandemic. So Dr. Williams and Mrs. Coppola, can you all talk a little bit about how your departments are dealing with the ongoing crisis, similar to what the other folks talked about?
Yeah, I just want to emphasize that because distancing is essential to flattening the curve, we essentially created or modified our system. And really the way that the clinic looks now is completely different to how we were functioning before COVID-19 hit. Yes, it causes some anxiety, I think, for our patients and our staff and our community, but at the same time, it's also decreasing it by visualizing and seeing everything we've done to ensure everybody's safety. So it's not just, it's our staff safety, our patient safety, and obviously the community as a whole, and we're all interlinked. So when you just want to kind of paint the picture, when you come to the clinic, you'll see that we have what we jokingly call now Tent City. But it's working wonderfully. We're able to maintain that distance We continue to see our patients. We keep the well children or well patients separated from those that may have any infectious symptoms or respiratory symptoms. And so that also helps the burn rate of the personal protective equipment that we're using. We assign our staff member to that station, and then therefore we're able to conserve a little bit more, and it'll carry us, further. Because we don't know what the future will hold, but we want to be prepared in every way.
So Brenda,
and, also,
sorry, I had a question for Brenda. So you work with maternal health and OBGYN. For moms and expecting moms, if you were to give them one piece of advice during this crisis right now on how to do their prenatal checkups or anything else with you guys, what would be the tips that you would give to moms or expectant families right now on how to navigate the system during this crisis?
First and foremost, if I want everybody to stay home, but this is why we quickly implemented our telemedicine project or way of continuing to see our patients and be there for them, whether it's a simple question or concern that they might be experiencing, with a odd symptom or something new. We're able to communicate with them, and if we identify anything that is concerning, then we have them come in and see them, face to face. But reach out to us. We're there for anything as far as communication goes. We will find a way.
Perfect. Thank you, Brenda. Dr. Williams?
No, I was just going to say, thank you, Brenda, for introducing it. Telemedicine is honestly probably the most exciting thing that I think, in my opinion, we've started here at the clinic. Not only here, but also just nationwide. It's really exploding. So just like Brenda said, it really provides you contact with your medical provider. You're still going to have questions. I have a 7-year-old. If I have a question about him and a rash that he has, I can call my doctor, and I can be given the same-day appointment where my doctor is going to call me. We currently do it similar to this. There's options for telephone. We're also starting options via video as well. So I can see him, you can see me. We can really talk and communicate. We're also going to be piloting a project where in our outside tents where we are seeing sick patients, your medical provider may not necessarily have to even come out to the outside tent. We can communicate with you also via telemedicine in our outside locations as well. So just like Brenda said, we really want for all of our patients to know that we are still here for you. Even though, yes, you should stay home, we are happy to answer any and all questions.
Dr. Williams, before I hand it off, since you work with pediatric patients, what we're seeing is a lot of evidence that generally people over 60 and also people with pre-existing conditions. So I'm getting questions from constituents saying, well, why can't my kids just go play with all the kids next door and go to the playground and play with all their friends? So even though we are seeing that this is mostly impacting those who are older and have pre-existing conditions, why is it also important that we make sure that our kids aren't going around and being around other kids during this time? Because that's a question that I'm getting a lot of the time from constituents.
It's a really very, very, very good question. There's a couple answers. The main answer is that while most of the severe cases, so most of the morbidity or most of the death in patients that are infected with COVID-19 is in the elderly, kids, one, you still can be affected, you still can have symptoms, even though it's less common, you still can get very sick. But the main reason is that kids or anyone, any age, can be carriers of the disease. So if my 7-year-old is around someone and he catches COVID-19, he may have very, very, very mild symptoms or no symptoms, but he could pass it on to my 70-year-old mother or to someone's great-grandmother or to someone who has problems with their immune system or someone who's pregnant. So that's why it's super important that the social distancing is for everyone, regardless of age. You really need to stay home just so that you're protecting others. And yes, kids, they can get disease, but then also, most importantly, they can be carriers of disease.
Perfect. Mariposa does a great job of caring for Santa Cruz County just on a regular basis, but during the pandemic, I know how hard you all are working. One of the questions that I get a lot of the time from constituents is how can we help organizations like yours? There are organizations that are making face masks and donating them to hospitals and healthcare providers. What can people do on top of staying home and making sure that they're not exposing themselves or others? But what can people do if they want to do anything to help Mariposa? And then how can they get in touch with folks at the healthcare centers if they wanted to do anything to help out? So I don't know who would be the best person for that question.
Sure. Thank you for asking that question. A couple of thoughts come to mind. And Dr. Williams can expand on that. We're very deliberate about our use of personal protective equipment. We pay close attention to our use of gowns, gloves, surgical masks, and N95. And then that's in short supply. But I wanted to reassure you and the public that we use them efficiently. We think, generally speaking, like many hospitals, we do accept homemade cloth mask. I think we will do that. We keep them separate in case we would need them. I think general recommendation by CDC as of last week is that citizens should wear non-medical facial coverings, either cloth or some other fabric, out in the community if there's going to be some closeness with people. So I think that that's fair. We are receiving them. I believe other hospitals are doing the same, so that's very much appreciated. And we're grateful for that. The second thing is, I think it's important to be learning of how these things unfold. And I think the community can be really helpful by learning about how to prevent the spread of this virus. That's really helpful. We've done a few sessions via Facebook and the radio and Channel 4 on how to reduce the spread. We see that as really, really important for us. And I think the third piece, and I'm sure the others can comment, is I think help each other in times of need. I think certainly Mariposa is here. We're doing some things to help our community. Something that hasn't been mentioned is that we do deliver medications to the patients' homes, particularly those older. But I think reaching out to each other in times of anxiety and fear, I think reaching out to our neighbors when they need help, particularly those older individuals who live by themselves or have limited resources. I think Mariposa is grateful for all of that because indirectly they're helping us to care for the vulnerable. Right. And I think that would be really, really helpful. I think this is a time of high anxiety, but anything we can do to help alleviate that, I think it's helping Mariposa indirectly. Because at the end of the day, we all need each other, whether it's Mariposa or otherwise. That's my answer. I'm sure others may have an addition to that.
Okay, just to follow up what Dr. P was saying, the community has really shown a lot of love towards our clinic and also to each other. And it does make a difference. It really does, because as healthcare workers we feel it, and it's just good for the community, especially in a rural community such as ours. It's just a lot smaller. It's a good thing.
I would also just recommend, just like everyone's doing, is to pay. You really want to make sure that you are able to pay acts of kindness forward. For instance, I was walking in my neighborhood and some kids, they painted rocks and they wrote like little kind sayings, and they put those rocks all around the neighborhood. Mm-hmm. Or I've heard other sayings, things where people are paying for people's gas. Obviously, we're all struggling right now. The economy, the stock market, everything's taken a huge hit. So those little acts of kindness really help. Just a few days ago, I went to one of the drive-through places here, and somebody paid for my meal. I guess it was the car ahead of me. So it's those little things that really make us human, and those really things that, especially in hard times like this, really can help.
I know these are I think that this pandemic has brought on a lot of challenges for not just the healthcare workers, everybody as a whole. But I've come to find that I rely on my colleagues, my teammates, my family, or my community on those inspirational messages and thoughts that are shared. And also, it's been very enlightening to see what and I'm grateful to have learned to appreciate those little things that we take for granted. Just remembering those little things, I think, will take us a long way to stay healthy.
And I think on behalf of Mariposa, going to expand on this question. We want to thank everyone in the community for helping us, for supporting us. And I think not only that, Mariposa wants to thank other individuals that help the community. And those are everyone working at the restaurants, the stockers at Safeway, at Walmart and Home Depot, the people working at gas stations, everyone that continues to work to keep us running in some ways, and sometimes we forget them. And this shows how interdependent we are. We depend on each other. So I think on behalf of Mariposa, we'd like to thank all those individuals that keep us running, and we're just so grateful and for them to continue to do the job. So thank you for the opportunity for saying this.
I'm so grateful that you all are taking time out of your really busy schedules. So I just have two last questions for the group, and then whatever you all wanted to share as last thoughts. The next question that I had for you is, we're entering into a really important time for a lot of folks. It's Easter Sunday coming up. It's the middle of Passover, and Ramadan is coming in just a couple weeks. We know that right now we're making people take sacrifices, and we're all having to play our part to make sure that even though we would normally get together with family or go to church or go to synagogue, we're asking people to hold off on that. But can you tell us, during this important time, my sister Alma's turning 27 on Sunday, we are doing things virtually, and we're encouraging folks to stay away from each other as much as possible to lessen that risk and to flatten that curve. So during this important time, why is it important for us in the community to help you all as healthcare providers? So you've mentioned a little bit here and there about like protecting personal protective equipment and making sure we flatten the curve, but what would be some of the things that you would say to folks saying like, why can't I just have my entire family come over on Sunday for Easter dinner? We promise we're all going to social distance, but there's going to be 100 of us in my backyard.
You know, that's a great question. We can answer that question in a number of ways. I think the way I see it is that, at least the way I think, it is a relatively small price to pay not to do that in order to keep our community safe. I know it could be an issue for patients and other individuals, but staying home keeps everyone safe. All we have to do is look at the images in New York, in Seattle, in other countries, to see what happens when we don't follow that. And I think in some cases, we have been relatively spared from that, and we can discuss the reasons for that. But if we don't do that, we can see what this virus can do. It can create chaos. It can create so much harm. So on one hand, you're absolutely right, but on the other hand, it's a relatively small price to pay to keep everyone safe. And one more thing that I like to say, you know, we, in addition to keeping our patients safe, we work really hard to keep our healthcare force safe. Without our healthcare workers, we couldn't do this. So you and Representative Hernandez, you mentioned it, and I think this came from New York. We are safe when people stay home, essentially. That's how you keep healthcare workers safe. And so I'd like to encourage people to stay home, enjoy Easter Sunday. This virus doesn't take a break Easter Sunday. And so it's important to stay home. And I'm sure Brenda, Gabby, and Dr. Williams may have other ideas about this.
I think it's a really good point. And I'm sure you've seen on social media, you've seen signs from healthcare workers all around the country that says that we stay here for you, please stay home for us. So just like Dr. P said, if you really want to keep your healthcare workers safe, that's exactly right. Stay home, still be with your family. You can easily connect just like we are via Zoom or via any of the other platforms. You can still be social, but again, by staying home, by preventing the rapid spread of this disease, by preventing people from getting really sick, that's the best thing that you can do for us.
And I'd like to share that I know it's been a little bit of a challenge for those essential personnel versus non-essential personnel. Like a healthcare worker versus somebody who has to be at home for an X amount of reasons. But your contributions are actually or will have a massive impact in staying at home, especially during this holiday weekend. No matter how small, you need to remember that we all count, we all matter in every way. And it's time to get creative. I mean, use that technology. Not only is it helping us to be in contact with our patients and continue to provide care for them, but have fun with it. Just Skype. Get on there and have a good time. And for those of us who have young kids at home, pull out the old Easter stuff and the old eggs, and it's time to get creative.
Wonderful. Well, I just have one last question for everybody before we sign off. And again, thank you so much for taking so much of your day. It was a little bit of a to get so many of you on the line. I was expecting just one. So thank you all so much for making yourselves available. What are the last things that you would kind of share with folks? So federally qualified health centers like Mariposa occupy a really important and unique space in our healthcare system because you provide healthcare to a lot of people who otherwise may not have access if it weren't for you guys. So I'm working with Senator Sinema and her staff, and then at the state level as well, to make sure that you get the resources and the support that you need at every level. But what are the things that you would want, if you had one last takeaway for folks before they sign off watching this, that you would share with them? So I don't know if we want to start backwards, starting with Dr. Williams, then and with Dr. Pereira.
Sure.
Sure, thank you. So I think that, one, you mentioned federally qualified health centers. When I came to this area 10 years ago, one of the main reasons why I chose Mariposa and that I chose this area is that Mariposa is a very special place. They have a motto that they really do try to provide high quality, the best care you can get anywhere in the country, regardless of your ability to pay. So that for me is huge as a provider. Most pediatricians and doctors, we go on this not for the fame and glory, but really we go into it just to help people. And it's very refreshing that we're at a place where we can provide such high quality care, again, regardless of your ability to pay. We have sliding fee programs in addition to very expansive access programs. Of course, we take private insurance. So my recommendation is just to stay connected to your provider. You may honestly receive calls from your provider just checking up on you. Telemedicine, like I mentioned, is huge, and a big component of that is us calling all of our patients, especially patients that have chronic diseases, and saying, hey, I know that you have high blood pressure, and I know that I saw you 6 months ago, but I just want to check in you and see how are you doing. Do you need anything? Do you need refills? So we are here for you. Please stay connected with your provider. And like I said, our telemedicine program is up and running, and it's ready to serve our community.
Thank you, Dr. Williams.
Reach out to us. We will find a way.
Thank you.
Also, we do offer a lot of services to our community outside of medical. We do have care coordination team, which which has become an essential part of our patient care, following up patients when they're discharged from hospitals, patients with limited resources. We try to find, whether it be a box of food for them, help them apply for access or a Medicaid if they don't have any. So we do offer a lot of services to our community, and we really hope that patients do take advantage of those.
And the last word, Dr. P.
No, I think well said. I don't think I have a lot to add. I think essentially we're all in this together. That's been said many times. I think prevention is what's going to help us manage this virus. And I think we're here to help in any way we can. It cannot be emphasized that we're honored and privileged to care for the community. It's really, it gives us great pleasure when people contact us and we manage them. So we're here to help, and thank you for the opportunity, Representative Hernandez, to help us present our what we're doing. And again, we appreciate your collaboration.
Again, thank you so much for joining me today. I can't wait to go back down and visit you all once this pandemic starts coming down, and doing what we can to continue supporting Mariposa and all of the folks in Santa Cruz County. I'm going to go ahead and post the phone numbers and the website for Mariposa, so that way if folks, after getting in touch with me, want to follow up and schedule an appointment over telemedicine before they come in person, they can go ahead and do that. But also to make sure that folks know that you all are open and still willing to see patients, even if it means doing it in Tent City out in the parking lot. Thank you all so much.